from the American Academy of Pediatrics.
Last year, an estimated 2.5 million people in the United States were forced from their homes due to natural disasters.
As communities recover and prepare for the future, pediatricians are on the front line.
We have to admire these heroes that created these clinics in the middle of the roads.
Everybody showed up that could show up to help in the beginning and still today.
But first, it's March, and that means it's time for First Up.
The first thing I would do would be to encourage everyone to read this article, because I think that it was really a wake-up call for me and not a happy one.
These stories and more on Pediatrics on Call, the podcast on children's health from the AAP. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. This podcast is for everyone in the medical community, keeping our children healthy and safe.
It's a show by pediatricians for pediatricians.
But anyone who cares about kids will get a lot out of it as well. Let's start today's episode with a look at the latest research from the journal Pediatrics.
Every month we do First Up, and every month I get excited to welcome one of the editors of Pediatrics to the show.
I hope our listeners are really getting to know how amazing the journal is and how passionate and dedicated the editors are.
For the month of March, we have Dr. Rachel Moon, the Associate Editor of Digital Media for Pediatrics, and, fun fact, a big fan of Korean television dramas.
Yes, in fact, she is the reason I am watching so many of them on my maternity leave. Rachel, welcome. And first question for you, any Korean shows you'd recommend for our listeners?
Oh, well, we could do the whole podcast on this and more. Just have to say, the one that I think is like the gateway drama for many people is, and I did recommend it to you, Joanna, is Crash Landing on You.
And I did watch it, and here we are.
And here we are. And was it the gateway for you?
Yes. It's fabulous.
Yeah.
Well, maybe some of our podcast listeners will join you in K-drama fandom. And speaking of TV, watching shows is always a good way for me to relax if I'm feeling stressed or burned out. So I'm curious about the well-being of other pediatricians. This month's journal has results from a survey about just that. Rachel, how are we doing?
First of all, I'd like to say that was a very smooth segue from K-dramas to burnout. So today, one of the articles we're going to talk about is about pediatrician career satisfaction. And on prior episodes of this podcast, we've talked about this. And in general, career satisfaction of pediatrician is quite high. More than 80% in general say that they're satisfied with their career as a physician. So this month, we have an article by Marianne Frintner from the AAP and colleagues from the American Board of Pediatrics, Bay State Children's Hospital, Indiana University, and the University of Michigan. And in this article, the authors do a little bit more of a deep dive, looking specifically at measures of career satisfaction and well-being before and during the COVID-19 pandemic. They analyzed data from the PLACES survey, and this is a national AAP survey that many of the listeners may know about. It was launched in 2012, and they have two cohorts of pediatricians, those who finished residency in 2002 to 2004, and those who finished residency in 2009 to 2011. So in general, people who are currently in their mid-40s and early 50s now. And then they survey these pediatricians, and there are nearly 2,000 of them, twice a year to ask about job satisfaction, well-being, and life experiences. The good news is that, again, in general, pediatricians are very satisfied with their careers, and that did not change during the pandemic. In fact, there were slight increases in career satisfaction during the pandemic, not quite statistically significant, but still, that's pretty impressive. And about 80% of females and nearly 90% of male pediatricians agreed or strongly agreed with the statement that they were satisfied with their career. So now the bad news, during the pandemic, there were increases in the proportion of pediatricians who reported anxiety, sadness, and stress at work. Interestingly, but maybe not surprisingly, these increases were seen in female pediatricians, but not in male pediatricians. Also, although females did not report increased rates of stress balancing home and work responsibilities during the pandemic, I think it's noteworthy that females consistently were twice as likely to report stress in this area than males were. And this is probably not surprising, particularly given that other studies looking at home and work responsibilities generally find that females consistently have more household and childcare responsibilities. And many of the participants in the Places survey are likely in the stage of life where they may have had children still at home, and the increased childcare responsibilities, virtual schooling, lack of outdoor activities during the pandemic really took their toll on all of us. Now, given that nearly 3/4 of pediatricians now identify as female, I think that this article should give us pause. I think we can't assume that everyone has the same responsibilities at work and at home. And I think that we need to remember to check in with our colleagues to see who may need more support.
And I think someone needs to do that K-drama and anxiety study and see if it brings it down to watch those.
Oh, I think that we could, Joanna, you want to collaborate? That would be fun.
Yeah, that would be great.
A new project that neither of us needs.
Sounds perfect, especially post-pandemic. But before we stop talking about COVID-19, it was actually one of the vaccines that I got in pregnancy, getting another booster to make sure that I was protected and hopefully that my baby was protected. And so I ask you, Rachel, did getting that booster really help protect my baby? Because I know she can't get vaccinated herself until she is 6 months old.
So thank you, Joanna, first of all, for getting the vaccine and for introducing this topic, because yes, the short answer is yes. So this month in Pediatrics, we actually have 2 different articles that describe strategies to prevent and or treat pediatric COVID-19 infection. And the first one discusses about how vaccinating mothers like you during pregnancy can potentially reduce COVID-19 infection in their babies. So in this article by Dr. Cindy Calderon at the National Institute of Allergy and Infectious Diseases and colleagues who participated in the Mommy Vax study group, the authors looked at the rates of COVID-19 infection among infants younger than 6 months of age when their mothers had received the COVID-19 vaccines during pregnancy. And as you mentioned, infants can't get COVID-19 vaccinations until they're at least 6 months of age. So this passive protection is really important. So Dr. Calderon and colleagues found that the higher the mother's level of antibodies against the COVID-19 spike protein, which is what the body makes after getting the vaccine, the higher the level of antibodies at the time of delivery, the less likely the baby was to become infected with COVID-19 in the first 6 months of life. And then mothers who received both the primary series and a booster dose of the vaccine had higher antibody levels than mothers who just received the primary vaccine dose.
And you mentioned 2 articles about COVID, Rachel. Can you tell us about the latest study on remdesivir? How does it stack up for our pediatric patients?
So that is a great question, and that's a question that many of us have had over the last couple of years. So Dr. Amina Ahmed at Levine Children's Hospital and colleagues from the CARAVAN study, which stands for Clinical Administration of Remdesivir After COVID-19 Diagnosis in Children, they looked at children who were hospitalized for COVID-19 infection. And I do want to mention as a disclaimer that several of the authors of this study are employees of Gilead Sciences, which manufactures remdesivir and also at least partially funded this study. So this was a phase 2/3 study to look at safety and efficacy of remdesivir in 53 children who were between 28 days of age and 17 years of age and who had confirmed COVID-19 infection that required hospitalization. 90% of these children had pre-existing medical conditions, and they got remdesivir once daily IV for up to 10 days. And the authors found that 83% of them had clinical recovery, and the safety profile of the drug was good, and there were no new safety concerns that were identified that had not already been identified in the phase 1 trials. So I think that this is one more tool for us in terms of treatment for children who have COVID-19 infection severe enough that they need hospitalization. And I think that both of these studies provide new data for us that we can use when we're counseling families about prevention of COVID-19 for the young babies, and then treating those children that are hospitalized.
I think we've been lucky as pediatricians that for the most part, COVID doesn't have a high mortality rate in children. But there's something that does: firearm use. And unfortunately, domestic violence is also something that children in the U.S. are exposed to at high rates. So is there any overlap between exposure to domestic violence and firearm violence in America?
So that is an interesting question. And we do have a study this month in Pediatrics by Alice Ellison, PhD, and colleagues from the University of Washington and the Regional Domestic Violence Firearms Enforcement Unit in King County, Washington. And what they did was they looked at a random sample of more than 3,500 domestic violence protection orders that were granted between 2014 and 2020 in King County, Washington. And 58% of these orders included minors who needed protection. And as a reminder, domestic violence protection order is an order from a judge that limits the exposure of the people who've experienced domestic violence from the person who is restrained. So sometimes it's called a restraining order or a protection order. So they looked at these orders and they found that the protection orders that include minors are more likely than those that don't include minors to have weapon use and firearm possession by the perpetrator. And 1/3 of them documented threats against the child, and 1/2 of them documented violence against the child. More than 2/3 of the violence involved a weapon, like a firearm. So these data are so sobering and really sad. And so what can we do with this data? So I think that the takeaways that I took away from this article was, number one, I think we need to normalize asking about domestic violence when we talk about home safety. So a simple question to the parent and to the child: do you feel safe at home? Sometimes is enough to get you some of that information that you need. I think we need to familiarize ourselves with resources for these families, both those families who decide to stay in the home and then for those who decide to leave, because both of those, there are definite pros and cons and risks to both decisions. And then I think we need to advocate for training for the judges who decide whether or not to grant these protection disorders. I think that they need to see this data too. And that's just the start. I mean, I think we could think about a whole host of things that we need to do. But the first thing I would do would be to encourage everyone to read this article, because I think that it was really a wake-up call for me, and not a happy one, but I think it's something that we all need to be aware of.
I am glad that we have this wake-up call, and I certainly hope that we all respond to it and maybe save some lives. So, speaking of waking up, it is spring. And Rachel, I have one last happy question for you. How can you tell spring flowers are friendly?
It's all you, Rachel.
How can you tell which? I don't know, David.
Rachel, they always have new buds. Buds.
I get it.
Yeah.
I get it.
Like it can mean friends, or it can... Okay.
Yeah, not the beer.
Man.
Not the beer.
No.
Not
You took that a totally
Budweisers.
different direction,
Yeah.
Rachel, and I respect you for that. Thank you. Dr. Rachel Moon, thank you for joining us today.
Thanks for having me, and have a great spring.
We are planning on it. For these articles and more, please visit our website at aap.org/podcast.
Coming up, we'll talk to two pediatricians with firsthand experience of disaster preparedness and recovery. David, I know you live in a place where there are lots of hurricanes, but have you ever encountered other natural disasters?
Well, you know, Christy's family lives in Colorado, and I cannot help remembering just a couple of visits ago flying home right through the smoke of the Marshall Fire, which I was very worried might get to her family's homes even by the time I landed.
It didn't, though?
No, thankfully, but I did have a college friend who lost his home in that fire. Except for hurricanes you mentioned, I've been lucky to avoid most natural disasters, but as pediatricians, we always have to be ready for them.
That's why we interviewed Dr. Scott Needle for episode 80 in September 2021 on disaster preparedness. Today, let's get a different perspective from two pediatricians helping their communities rebuild after different natural disasters. Dr. Felicitas or Feli Livaudais is a pediatrician on the island of Maui and on the board of the Hawaii AAP. She practices with Kaiser Permanente there, where she also teaches at the John A. Burns School of Medicine at the University of Hawaii and serves on the board of Emua Family Services.
And joining us from another tropical island, we have Dr. Cindy Calderon, past president and current executive director of the Puerto Rico chapter of the American Academy of Pediatrics and a board member of the National Advisory Committee for Children and Disasters. She led response and recovery efforts to both Hurricane Maria in 2017 and the 2020 earthquake that followed. Drs. Livaudais and Calderon, welcome.
Thank you so much. It's wonderful to be here.
Yes, it's nice to be sharing with you.
We're so happy you're here. David earlier brought up the Marshall Fires, which were the worst in Colorado's history, but Hawaii also had a tragic and historic fire. Feli, can you tell us a little bit about your personal experience with the Maui fires?
The fire happened August 8th, last year, 2023, and Lahaina wasn't the only fire in Maui that day. We only have 158 firemen thereabouts in Maui, and there was a fire in Lahaina, there was a fire in Kula, and then there was a fire close to Kihei where I live. So many of our friends were also evacuating from Kihei. There were many people without power. The winds were just crazy. And initially, around 10 a.m., the firemen thought that the Lahaina fire was okay, and there's 30 houses burning in Kula. So many of them went upcountry to help Kula and left the skeleton crew in Lahaina. And as the day wore on and the wind swept through Lahaina, the power lines started to go down on the dry grass and ignited. And it went very quickly and destroyed our old town.
And how are your patients affected by this fire?
My patients are mostly in Kihei, but I do have some families that come from Lahaina to see me. But my friend, Dr. Carolina Dembinski, is the Lahaina Kaiser pediatrician. Her patients were extremely affected. 13,000 people lost their homes. And before the fire, about 3,000 children were enrolled in the Department of Education. That's not including the private schools and not including any children 5 and younger. So many were displaced and many of the homes were uninhabitable because there was lack of infrastructure. There was no water for a long time and no electricity for a long time. So it was just massive numbers of people who were injured or homeless. And then we have about 100 people who died in the fire that didn't make it.
That is unimaginably tragic. Cindy, you went through not one, but 2 disasters in Puerto Rico. Do you mind sharing your story of either or both of them?
Yes, Puerto Rico is a tropical island, and one of the threats that we constantly have is the presence of hurricanes. I've lived almost all my life in Puerto Rico, and previous to this big hurricane in 2017, I did live another major hurricane about 25 years previously. So the experience of my previous hurricane really prepared me to understand what the threat of a hurricane represented. Although I must admit the 2017 hurricane was much worse, 6 times worse. So it was a life-changing experience for everybody. It was living without electricity for many folks for more than 6 months. No water sources. Once electricity falls, all the other utilities are affected. And It was an unprecedented disaster for the whole island. It wasn't just one section of the island, but the whole island. And because if it's an island, we depend on incoming food, and many of our resources come in by plane. And it affected the airports, it affected the ports. So we were kind of a little bit on our own. Then when we were recovering from this, which has taken a long time because of all the damage to the infrastructure, we had the earthquakes on the south of the island. And despite that the major structural damage was in a limited area on the south of the island, the rest of the island lived the stress of constantly feeling the trembling of the grounds. We were all living under this constant stress. Are we going to have a larger earthquake that's going to affect all of the island? But I must say that through this experience, what we discovered was our resilience. And we discovered what are the areas that we needed to strengthen and what areas we needed to give more help. I must say that it was a learning experience, a painful one, but we survived. And nowadays we are still surviving because we were recovering from the earthquake. And 3 months later, we started dealing with the pandemic.
I cannot imagine. So what's it like now? Are there still aspects of these disasters affecting your patients today, Cindy?
Well, when the major first disaster, the hurricane, happened, I was working with the Department of Health as a pediatric consultant. And that gave me the tools to be able to lead many of the efforts. We joined the 3rd Tertiary Hospital and the pediatricians and the residents, and we were able to reach out to all the organizations and other agencies to work together to identify the most vulnerable populations, the greatest needs, and to be able to serve as a liaison to help the communities continue to organize and to respond adequately. So we were a facilitator in many ways. Practicing in that time, I can tell you because our colleagues would come to us for materials, medications, cleaning materials, whatever they needed to help the populations. It was difficult, but I admire my colleagues because what they did is they went out to the communities. They didn't stay in their offices. They didn't stay in their clinics. They got their equipments together and they went out and reached out to the most vulnerable, and they reached out to the communities, and they shared the care, the clinical care of all the patients they encountered. After the earthquake, most of the people had recovered from the hurricane, and we had the same response again. The people in the northern of the island moved to the south on the weekends to help all the population. And we have so many anecdotal stories, which are we have to admire these heroes that created these clinics in the middle of the roads. And they would bring medication, and they opened it up to all the population to come to have an alternative to be able to receive the care that they require. When hurricanes and earthquakes occur, there could be loss of life, and there can be a lot of damage. There could be people hurt. That was not the major problem. It was the change in the routines of life, the increase of risk of infectious disease in overcrowded shelters, or people had to live with relatives. So there, as physicians, we had a very important role to share with the community how to protect themselves, how to decrease the risk of contagion, how to deal with the environmental contamination that occurs after any kind of disaster, to protect themselves and their families, and to continue to promote what we know as preventive medicine, avoiding accidents, because children are on the streets, children are not in schools, children are in bicycles. And so that was a very important role that we played. And supporting breastfeeding, for example, and infant nutrition, because these are aspects that become very important after a disaster.
Thank you for sharing your stories of survival. I'm wondering now about preparedness. Feli, was there any indication that these wildfires were going to occur, and what was already in place to help with disasters in Maui?
It's interesting that about 2 months before the fire, Dr. Curtis Toma, he's the Medicaid director for the state of Hawaii, he got a grant from the AAP to do disaster preparedness. And so he, let me know, and I got a whole bunch of doctors together. There were 40 or 50 of us. We went to Maui Brewery. We didn't drink too much beer. And we did scenarios on disaster preparedness. And it was from every sort of doctor in Maui, from specialists to pediatricians, and from hospital doctors to community doctors, Kaiser doctors. And it was just good to start building those relationships. So when the fire happened, Maui's an island and we pretty much know everybody. The medical coordination was pretty good. And when the shelters started to open, everybody just went to the shelters to help. And we also all housed Lahaina survivors. So at one point, there were 11 people in my house, a school teacher and her family, a Red Cross worker, 2 doctors from elsewhere who were helping. A lot of the other pediatricians housed, just people because there was no place to go other than the shelters. And to your other point, how are my patients affected? In Kihei, of course, the ones who had relatives in Lahaina, they took them in, but also we had a lot of Lahaina families start leaving Lahaina. And so now I have a big portion of my panel are now patients who used to live in Lahaina, but have resettled in Kihei until their house can get rebuilt. So it was fortuitous for Dr. Toma to do that disaster preparedness for us. And I think that on reflecting on this, climate change has just caused extreme weather patterns. And we have had more fires in Maui in the last 5 years than ever before. And this one was just the biggest one ever. And I think that we can do things that can mitigate damage in the future. For example, communication was difficult when there was so much wind and no electricity, and maybe people's cell phones were not working. And we have a tsunami warning alarm that was not activated because it's for tsunamis. But hindsight is like, oh my God, we could have let people know earlier to leave their house if that was activated. So, of course, it's Monday morning quarterback, right? There could have been things that, for example, just investing in the aging infrastructure. Lahaina is hundreds of years old. There's narrow roads, and maybe, if a tree falls down in the middle of the road, what can be done? There's no escape routes. And there was one street where many people died because they just couldn't get out. So there's so many things to think about. And I think that when in the rebuilding of Lahaina, I'm sure that those things will be coming up. But one big thing is be prepared and be ready to improve communication, even without technology. So maybe it's radios, maybe it's body cameras for policemen, maybe it's WhatsApp when the internet does flicker and you can send your text messages, but you might not have cell signal. So those are some thoughts.
And Cindy, I'm curious your thoughts about preparedness as well, because Puerto Rico is no stranger to hurricanes. So how does the island stay prepared for natural disaster?
We've been promoting a lot the preparation for families, and we've been emphasizing how important it is, especially if you have vulnerable family members, children with special medical care needs. And we understand this has to continue because as new families are formed and they haven't had the previous experience, we need to repeat and repeat and repeat and help them prepare. Physicians also have to prepare your offices. I think we are preparing better than before. We never thought we would be without electricity for so long. So physicians are responsible to prepare their offices for the safety of their documents, the safety of their vaccines or the medications they have under their control, communicating effectively with their patients so they know what the alternative A, B, or C plan is to reach them, especially pregnant women. They're not our patients, but their unborn child will be our patient. So these are some of the steps. Besides that, we also promote following all the recommendations from the different agencies to prepare each hurricane season previous to the season arriving, like having enough water for each person, having non-perishable food, batteries, etc. It's a long list. So we've been working as a chapter to teach the community leaders as many skills as possible, because we understand some areas become geographically isolated. So it's usually the leaders in the communities who will be able to reach out to the population and give them the first aids and help them, while the agencies can reach. Preparedness is very important. It's not an afterthought. It has to be in our minds all the time. If you live in an area where there's earthquakes, we're always talking about having that bag ready near the door if you have to run out with essentials so you can survive. And we also learned that with the earthquake. And we need to continue to promote, especially in our young mothers and young families that want to have children, breastfeeding as a very important strategy of survival in infants. So when we talk about breastfeeding in Puerto Rico, we also remind and remember we're an island, and if it's a big disaster, there's nothing that will be able to take the place of breastfeeding.
So, Dr. Livaudais, what would your key messages be to your pediatric colleagues in other parts of the country about preparing for natural disasters?
I think it's important to have relationships with community partners before they happen. Just knowing who to talk to, or coordinating maybe the local Red Cross or the local disaster preparedness. There is somebody in every place. That's their job. And just knowing who that is and what the plan is. Ben Hoffman, Dr. Hoffman and Jane came to Maui, and we had dinner with a bunch of pediatricians, which is lovely. And he just emphasized that children are a third of the population and they cannot advocate for themselves. So it's our job to advocate for them, whether it's vaccines or childcare or whatever the whole family needs. And I think that having children at the top and not just an afterthought during a disaster is really, really important. And having relationships in the community, whether it's a nonprofit or government agencies, so that things go smoother when there is a disaster, which in our world right now seems more and more likely, unfortunately. And I would like to say something about Maui's response. I'm so proud of my community. It was the 6-month anniversary just a couple days ago. Excuse me. Everybody showed up that could show up to help in the beginning, and still today. You know, people on boats, people who had airplanes to get people from the west side. It was just an amazing community response. And the big, excuse me, in Hawaii we call it kokua. Kokua is to help without, to help just because you want to. And there were lines of people who emptied out their closets and their cupboards to bring to the shelters in the beginning. And the teacher who stayed with us, she saved her next door neighbor's life. He was 80-something years old, and she was preparing to evacuate. And she hadn't seen him all day, and, you know, there's no electricity, so she knocks on his door and says, "Hey, Joe, are you ready to evacuate?" And he's like, "Why?" And the fires were coming so quickly that if she didn't get him, he would have died. And she brought him to the shelter where my husband was working. He didn't have any of his glaucoma medicines and high blood pressure medicine, and a nurse immediately bonded with him and got him his medications, and people were coming up to him and calling him uncle and giving him food. And when she brought him to the airport to reunite with his daughter in the mainland, he had such great feeling of community and love from the shelter. And I think it was a terrible thing, but it just showed us how a community can come together to help.
I want to add to what just Feli said, that
Please.
as physicians, when we live a disaster, we live the disaster. We will have all the stress and the fear and the threat like anybody else. When I reached out to Feli the first time, Feli, remember what I told you? You're overwhelmed. You're doing a lot. You need to stop and breathe, because you're living the disaster, and you did a great job. So as a pediatrician and a colleague, what can we do when we see disasters in other areas? Is wait to reach out when they're ready, because we can also overwhelm them when we try to help them without doing a good needs assessment. So we were able to use the channels of the American Academy of Pediatrics and their Council on Children in Disaster. They were very helpful, the staff, and they were the ones who allowed us to get communication between her, me, and many other colleagues that have been through disasters to reach out and help them organize their ideas, give them support so that they could optimize their recovery process, because it's difficult when you're in the middle of a disaster. You're overwhelmed. Your thought process even changes completely, and it takes a little time until you recover yourself and you're able to do that needs assessment, which is so important. One of the messages that I have brought to many agencies is don't displace the physicians of a disaster area. Reach out to them and ask them what they need and help to provide what they need. Not necessarily it will be for many people to come and do the work they do. That's not what they need. What they need maybe is resources to do their work.
I definitely felt the love from you, Cindy, and from so many people from the AAP. Dr. David Schoenfeld came to Maui and shortly after the disaster and gave us some talks on vicarious trauma and what not to say to people who have been through such loss, and just kind of help us do some psychological first aid at the office until people who went through the trauma could get professional help. So many people just have reached out and also have given us a lot of resources like disaster relief, and Pfizer gave us vaccines for our Keiki Health Fair. Cindy gave me that idea because she said, remember vaccinating, and so many people were displaced and we didn't have PCPs in Lahaina. And I was like, oh, we need a Keiki Health Fair. We need to give everybody their vaccine records again because they were all burnt. And we need to make sure that they get the flu vaccine and the COVID vaccine and, see if we can get the babies for the other vaccines that they're needing. And that was, at least it gave us a jump start. And also we got extra vaccines from those organizations to continue the work through the winter. So that was really helpful. And I really am very appreciative of the resources that AAP has given to Maui. Everybody's been so amazing.
Dr. Felicitas Livaudais and Cindy Calderon, thank you so much for talking with us today.
Thank you.
Yes, it's been very nice to share with you our stories and all that we've learned, and we're always available to help each other, our colleagues, wherever they are, in a disaster.
For resources on disaster preparedness, go to aap.org/podcast.
At the end of every episode, we like to leave you with something positive or enlightening. We call this segment Say Ah. David, what's your Say Ah this week?
Well, Joanna, I am so excited to be heading back to Colorado with my wife. That's where all the rest of her family is. Our son has moved up there already, so we're going to see everybody up there. I'm going to attempt to remain upright on skis again, and I'm just going to have to report back on how that goes.
My say is that, I finally got Zelda's vaccines in. And I'm super excited about that because I feel like it's the beginning of her immunity and protection, and maybe I'll feel a little bit better about bringing her out more, but she can't get measles yet, so we'll see. But anyway, I'm excited about the vaccine she did get.
Well, that is absolutely awesome. I'm excited for her. That's it for today's episode. If you like Pediatrics on Call, please subscribe on your favorite podcast app and help us spread the word. Follow us on Facebook and Instagram at Pediatrics on Call.
Pediatrics on Call is a production of the American Academy of Pediatrics. Our producer and editor is Ann Johnsos. Our audio engineer is Doug Nagel. Joe Puskars is our associate producer, and Susan Martin is our executive producer. Our theme music was composed by Matthew Simonson. Join us next week when we'll have a special episode about early hearing detection and intervention.
We'll also look at how the use of child fatality reviews can help save lives. I'm Dr. David Hill.
And I'm Dr. Joanna Parga-Belinkie. Thanks for listening.